Hello, wherever you're watching me, you're welcome to another edition of my program called Health Talk with Queen Nikki. Health Talk with Queen Nikki. Have you subscribed to my YouTube channel? My YouTube channel handle is called Health Talk Queen 1, Health Talk Queen 1. And also my TikTok is called Health Talk Queen. Please follow me, like, share, comment, learn. I'll be bringing yummy tip that you don't want to miss out. Who can guess today's topic? Let the bell roll. So today we are going to be discussing about asthma management. Management of asthma, education, teaching. I told you guys that we are not playing this year. We are going to be going right into it. So asthma is my most asked topic for the past 2 weeks, and here let's go. So what is asthma? Asthma is a very chronic lung disease that is affecting people of different age. It can affect both old, young, name it, it can affect them. But what is asthma itself? It's caused by an inflammation and muscle tightening around the airway. That's what asthma is. So like I told you guys, we are not going to be going into disease process, how we know. We are just going to go to causes, signs and symptoms, and the prevention of asthma. So what are the triggers? What can trigger asthma attack? Asthma attack can be triggered by air pollution. If you have air pollution that is contaminated, that the person with asthma exacerbation inhale the air, it can trigger asthma attack. Dust, if we have dust or the person is around where it's really dusty, it can trigger asthma. Also, too much exercise, right? This is contraindicated. With asthma patients, their exercise should be moderate, and I'm going to talk about it when we get to prevention. But too much exercise or rigorous exercise or work, hard work ethic, it can trigger asthma attack. Mold, like the mold that is usually in our bathroom, it can trigger it. Pets, yes, some asthma patients, they are allergic to pets. Dog, cat, they're allergic to it. You just have to make sure you take your child to allergist testing center so they can test if they are allergic to pet. Smoking, yes, if they are in an environment where people smoke, it can trigger their allergy exacerbation. We also have certain occupation, like if they work in a certain environment, that require hard work, it can trigger their their asthma exacerbation. Bacteria or viral infection, and also unhealthy lifestyle or family history can trigger asthma exacerbation. I'm going to do this in 2 parts, hopefully, because I don't think I can finish it in 1 part. But if you have 2 parts, make sure you watch the part 2. What are the signs and symptoms of asthma attack? Asthma attack signs and symptoms are the chest wall will be really tight, and very painful. It will have like a painful pressure and really tight. They will also have constant coughing, especially at night. Constant coughing. Sometimes they might have productive mucous membrane, or sometimes they might have dry cough, but it's going to be really constant. They will be having a shortness of breath and very difficult in breathing. Asthma patients, you see them, especially when they sit down, they tend to breathe like that's how you hear them sing. Sometimes they get wheezy. Wheezy is let me see if I can imitate wheezing. I want to try and imitate it. They sound like the that when you listen to them with your stethoscope, especially the nurses, this is how they start. They have like expiratory and inspiratory wheezing. Sometimes they might have expiratory only or inspiratory wheezing, especially when they have another infection with asthma that attack. So they sound like this. That's how they sound. Okay, they also have difficult in breathing. Yeah, they have really, really, sometimes you see them, they breathe like that. Yeah, I hope my sound it can be audible enough. They also have they are pale and sweaty on their face when they are having this attack, and also difficult in talking. When they talk, they can barely say a sentence. If you ask them what's your name, they might say, "Oh, my name." That's how they talk. So if you can identify this signs, and I'm going to go over the signs again. With asthma attack, the signs and symptoms are chest tightening, pain or pressure, very tight pressure, coughing, especially at night, shortness of breath, difficult in breathing, pale and sweaty face, and also difficult in choking. Yeah. So what are the treatment of asthma exacerbation? This is the part I love. When you have kids that have asthma exacerbation, what are the treatment? What can you do? What are the prevention? Number one, if the asthma attack is occurring and you use rescue medication and it's not working, please take the patient to the nearest hospital or to the ER, especially when they are kids. Take them to the ER immediately. But what are the things that they can do to prevent asthma attack? Number one, exercise. Now, I said too much exercise can trigger their symptom, but exercise that they can tolerate, and it should be mild, is good for asthma attack. Okay, to prevent it, mild minimum exercise that they can tolerate is very, very good. Maintaining weight, maintaining healthy weight, and eat right. Take your multivitamin, eat right. It can help with asthma exacerbation. Avoid triggers. All those triggers that I mentioned, like the pet, dust, smoking. Avoid all those things so you don't get triggered. And if you have allergy, treat the allergy symptom. Treat it. If you have allergy, use your allergy medication. Make sure during allergy period you put on mask. If you have asthma as part of your medical history or asthma disease, make sure you use your allergy medication when you are in allergy season. And also, there are some medication that the doctor can prescribe if you have asthma attack, or if you're a non-asthmatic patient, they will place you on this medication. It's called inhaler. Sometimes they put them on steroid. Sometimes they put them on bronchial dilators and other stuff. I don't like to mention medication on my channel, but the best thing for you if you're having asthma attack is to please go to the nearest emergency room where they can further take care of you, because if they don't do medical intervention immediately, it can result to something very, very deadly, and you don't want to do that. Okay, I'm just rushing through this topic because I know it's not asthma is a well-controlled disease process. At the same time, it can be dangerous, but once you avoid all this things, you should be good to go. Okay, don't forget to subscribe to my YouTube channel, Health Talk Queen 1, and also watch out with asthma. I will be bringing a chat on my TikTok. Watch out for it. I will explain further what asthma is, the signs and symptoms. You don't want to miss out. Once I finish loading the next day, I'll be bringing chart. I'll be bringing information about asthma exacerbation. I hope this helped. And I hope I did it in one part. And till I see you guys in my next episode, don't forget to subscribe, and I'll see you very soon.